had my physical therapy appointment recently, and I wanted to share the what I was coming in for and how the process went, in hopes to help just kind of continue to open our mindset about how the body functions. So I've been going to see this physical therapist for a few years now for a few things, but one of the lingering issues that I have in my body is some cheek issues following a dental implant replacement, which kind of pairs with some like neck tension that I've had, headaches, and then also some rib cage discomfort around the right side. So I'm actually only seeing her about every 6 months right now because I've been doing much better. But it was funny, the night before I was going in to see her, my left knee and ankle were really like yelling at me. I was laying in bed and I was like, I haven't really shared that piece of the puzzle with her recently, or if ever. And I just have an old ankle sprain there. I just thought, orthopedically, I'm taking care of that. I got game plan. I actually had ozone injected into it today. But I just had never brought it up before. So, and then the other thing I shared with her at the appointment was like an itchy scalp. And what I had tuned in over the last 6 months since I had seen her last was the itchy scalp is only on the right side, this side that I have a lot more challenges with. I've had people check my scalp. I'm like, is there something crawling in there? Do I have like pimples or what's it called? Dry scalp. You know what that is. But none of that was the problem. But I tuned in and it was the right side. So I shared that with her. So when she listened to my body, her hand pulled tension to this right side, which is kind of a common area that needs tune up for me. But what was interesting was when I mentioned the scalp and then the foot, she did a little bit of a deeper dive into my posture, and she pushed gently down on my right shoulder to just feel through tension in the system. And my body wanted to shift. Instead of naturally just kind of compressing down here, it wanted to shift over to the left leg. So that was curious really to both of us. When she pushed down on my left shoulder, I just was able to stay grounded and not move in here. But as I push, I can even just feel that shift still kind of wanting to happen with that. So when she knew she was gonna work this area first, but she did go down and listen using our evaluation techniques down at the feet when I was laying down, and she could feel there's a fascial connective tissue line that goes from the outside of the leg and then actually crosses over the abdomen and up into the right shoulder. So remember again my history with the right rib cage here, and I've also struggled with being able to activate my core mostly only one direction. I remember when I was doing CrossFit and trying to do toes to bar, even knees up to elbow, the right side would always fail. Even with V-ups, sit-ups, I would literally be doing crunches in a circle because this side just wouldn't engage. And I know after seeing a pelvic floor PT that my internal, or my obliques in general are really tight on this side. So just feeling this line of tension from the left ankle all the way up here and potentially tying into this jaw stuff. So I shared with her that I was getting ozone in my ankle this week, which is what I did today. I've also had some shockwave done on the ankle, really old ankle sprain back in high school when rehab wasn't really a thing outside of regaining your balance and icing it. So it's just been, and I've sprained it a bunch of times playing soccer in college and even after that. So it's just very stiff, starting to travel up into the knee. I've had a history of hip impingement, no known injury that I know of, but back when I was doing a lot of heavier lifting, this left hip. So she was curious. She treated up here, but she was curious, hey, I wonder if this ozone, and once we get this fascial line of tension to let go, if this will finally resolve. So that's kind of where I'm at today. She mostly, when she worked up here, she checked into my scalp mobility. So all the different fascial layers between the hair and the skull, and worked that with some glands in my cheek, and then worked a lot of the fascial system up on this right side down into the rib cage. So that felt great. But we're gonna did the ozone today, and tomorrow I'm gonna see her again and do some brief fascial line work from the ankle, and just see how this, obviously I want my ankle and my knee better, but very curious to see how that ties into all of this. So stay tuned for that.